the webinar, Navigate the Future of Healthcare with a Data-First Approach. Our speakers will be sharing how to use data-driven insights to enable your healthcare organization to optimize processes, allocate resources effectively, and reduce inefficiencies, leading to cost savings and improved productivity. We'd like to go over some technical details before we begin. Those of you in our audience are in listen and view only mode, but we encourage you to participate. Here's how. Throughout the presentation, please enter your questions in the chat function and click send. We've saved some time near the end of the webinar to answer your questions. Should you need any assistance during the webinar, please don't hesitate to contact us via the chat function. We'd also like to thank the sponsor, Treatance. Our speakers today are Pradeep Kumar Jain, Senior Director of Treatance, and Fred Ward, Chief Executive Officer of Marquee Dental Partners. Pradeep and Fred, the floor is yours.
Thank you, Maria. Hello, everyone. This is Pradeep Jain here. I'm one of the Senior Director and the Senior Client Partner at Treatance. Just to give you a quick introduction, I manage all the the CXO relationships, working with a lot of healthcare organizations, try to understand and solve the last mile adoption. Along with me, I have Fred, who is the CEO of Marquee. We go a long way back. Some of the important challenges we have solved for Marquee, and we are very excited to share some of our learnings as we go through this. So just to start it off, right, I think it's very important we understand that most of the healthcare leaders today are under immense pressure to optimize operations, accelerate M&A. And some of these challenges are probably macro as well as market conditions, right, like data utilization. One of the trends that we have been seeing is currently only 57% of healthcare data is utilized for decision making. Right, and this remains a major opportunity for leveraging analytics for the remaining 43. Strategic challenges, right? Only 1 out of 5 healthcare executives are planning to divest their underperforming assets in 2024, which underscores the need for precise data-driven valuation and performance metrics. The third one is the financial distress. Nearly 1 in 3 hospital or system mergers in 2023 were driven by financial distress, highlighting the importance of robust financial analytics and risk assessment tools. And finally, the success rates of M&A. 3 out of 10 M&As across various industries failed to achieve their goal post their M&A. These statistics are important for us to understand why analytics is needed. Some of these data we have collected from Becker's Chief Healthcare Executive at Harvard, which underscores the critical need for effective data utilization and strategic operational improvements and operational efficiencies to navigate these challenges. Moving on to the next slide. So for a second, let's imagine a scenario where healthcare M&A can be executed seamlessly with new capabilities activated from day one. No operational disruptions, which means seamless integration of an existing workflow, API-driven integration, and taking care of the data interoperability challenges. Out-of-the-box reporting. Think of this, access to all comprehensive out-of-the-boxes reports on day one, enabled pre-configured analytics, dashboards, and reporting capabilities. Immediate value creation. Now, this is a big important factor for any M&A, right? Which is the ability to immediately initiate value creation strategies driven by analytics and most importantly, driven by data-driven support systems. And finally, scalable model. Developing a scalable model that delivers proven benefits for PE investors and acquired firms through cloud-based infrastructure and scalable data pipelines. Sounds too good to be true. But this scenario was precisely the challenge faced by Marquee Dental Partners, a national nationwide dental organization, which we will explore in detail next. Over to you, Fred. Fred? I think Fred has probably lost his connection. Yeah, Fred, we can hear you.
All right, sorry about that. I got disconnected. Good afternoon, everyone. I'm happy to be here with you. Let me set the context for you on Marquis Dental. First of all, why would Marquis Dental even exist in a country like ours with hundreds of dental service organizations? Why Marquis Dental? Why were we needed? And I would tell you that we were purpose built. And our purpose simply is our vision statement, which is we want to improve overall health through better oral health. And I'll give you a couple of statistics that I will refer to later on. 54% of the American adult population over the age of 30 have a restorative need, meaning a crown or a filling. 62% of the American adult population over the age of 30 has some form of gum disease. Okay, so 54% have a restorative need, 62% have gum disease. That means for Marquis Dental, as an example, 1,100 patients a day that my dentists see and treat have a restorative need, and 1,250 per day have disease. All right, so when we talk about our vision and the purpose behind Marquis Dental, we're here to address those pretty drastic dental statistics and look at the overall health of the populations we serve. We know that better oral health improves, or poor, let me say it the other way, poor oral health leads to dementia, cancer, pregnancy complications, kidney disease, stroke, ED, arthritis, and those are just to name a few. Okay, so there's a purpose behind why we're here, and in order to fulfill that purpose, we needed better data. And we existed in 5 states. We exist today in 5 states in the Southeast: Arkansas, Alabama, Kentucky, Tennessee, and Florida. We have about 80 offices, and every year we buy more practices. And you can imagine, as you buy private practices, the practice management software, or the EMR, that may be a more familiar term to many of you, those systems are disparate. In the dental world, we buy practices who have EagleSoft as their software system. Some have Open Dental, some have Denticon, some have Dentrix, some have others. And at one point in time, we had 11 different systems. So as we were acquiring, we acquired practices and had accumulated 11 different versions of an EMR or practice management system. And that created real data problems for us and real analytic shortcomings for us. So this is the context that I wanted to set for you. So as we go through this, you'll have a frame of reference. All right, so when we engaged with Treatance, we had 42 practices. Today we have close to 80, so we've nearly doubled in size. And you can imagine with the challenges we had growing from 23 practices when I arrived at Marquis to 42 when I engaged with Pradeep and his team to where we are today with 80 practices. That doubling in size created real data challenges for us. I had tried in my time since 2018, 2 other companies that do what Treatance does for us. And in both cases, we had data definition challenges. EagleSoft, for example, would define a returning patient as a patient that came back within the past 12 months. Denticon would define a returning patient as someone who had come back within the last 18 months. And Dentrix would define a returning patient as someone who had returned in the last 2 years. So you can see that as our system grew from 42 practices to 80, we had data definition problems. That was just the beginning. We had timeliness problems where each software system would upload data at different times of day. We had accuracy problems in our reporting and these types of challenges. And then I would tell you, just for my operations team, they needed better dashboards and KPIs that were meaningful to them. And our previous solutions, prior to arriving with Treatance, our previous solutions gave us canned dashboards. So these were dashboards they had created that had KPIs that I would never use, my team would never use, and made little sense to us, frankly, in the way that we lead the business, operate the business, and so on. So that led us then to Treatance. And here's the approach that we took with them. And this is a bit of an eye chart. So let me try to draw your attention to the middle of the chart. Below the long orange bar, there are 5 columns there. And so let me just hit a couple of highlights here for you. First of all, with Treatance, they help us address our data quality. If you move to the middle column, where there's a reference at the top in orange letters, a unified data model. What we got from Treatance's work was we got a unified provider level KPI, we got a unified procedure level KPI, and then moving further to the right in the library for KPIs, we were able to define KPIs that mattered to us as a dental support organization. And then in that final column, again, under that long orange bar, you can see the reference to dashboards and user consumption. Now I had at the tips of my operators every morning at a consistent time, a consistent, accurate, timely, and comprehensive set of data for them to go operate the business. And each of my regional managers has 10 offices. So every morning they get up, it's part of their routine. They download their reports from Treatance, and they can quickly see how their practices did yesterday, how they're doing for the week, and how they're doing month to date. So again, there was a lot here, and I didn't mention to you data security. Certainly with personal health information, we had to make sure we had that bit of data secure. I mentioned data definitions previously. We align data definitions across all of our softwares, and so Treatance, the nimble nature of Treatance enabled all of that for us. And then if you go to the far right column, because we had timely, accurate, and comprehensive data, we were able to close gaps in data. We were able to improve the treatment plan follow-up for our patients. We were able to not only would we provide a treatment plan, but if we could see with the data that we were able to get from Treatance, we could see when patients were not coming back in for that treatment. We could then follow up. We could create lists of patients to call, their phone numbers, what their date of service was, what the recommended treatment was, and so on. So my point in saying all of this to you is the data that we got from Treatance became very actionable. And an operations team without actionable data is not a very effective operating team, as you probably all realize. Then in the very bottom right corner, what I'd say to you is the future, right? The reference in the bottom right corner to smart answers to patient questions. I would take that a step further and say to you that there's a future here with Treatance in generative AI. And my quick frame of reference here is that imagine when you're trying to solve systemic healthcare challenges through better oral care, and you can bring the data sets, the patient histories from both of those healthcare verticals into one unique patient record, and now turn on a generative AI system, the types of recommendations you can get, the types of actionable treatment, life plans for people, health plans specifically tailored to that patient, and how powerful that can become. So I'm going to quickly cover a couple of practices as a case study for how we used the Treatance, the system and the data to help us integrate a couple of practices and then what the key outcomes were from that integration. So these are a couple of practices, same doctor owner, one in Anniston, Alabama, and one in Woodland, Alabama. And we do our standard, when we buy a practice or partner with a doctor, we do our standard website makeover where we provide a description of what type of dentistry those doctors do in that practice, the types of treatments patients can receive. We put a Google map in there, the street address, and those types of things. And then what we do, we start before the partnership becomes official and the close of the practice happens. What Treatance allowed us to do is to take data that we were given access to during due diligence, put that into our system. So we could now look at these practices that will become a part of the Marquee platform at some future date. And we could look at how those practices perform against our KPIs using our data definitions. And you can imagine now we can see where the opportunities lie. So we were able to quickly identify by having this data uploaded into Treatance, we could identify opportunities. So the day after the partnership closes, and now those practices are operating as part of the Marquee platform, you can see now we could game plan where opportunities existed because we saw it in the data before we closed. We can also see where the strengths lie for those doctors, those hygienists, and in those particular practices, we can see what they're really good at. All right, and so the net of all of this, and I could cover all of those boxes for you, but I'm just going to cut to the chase. The net of this was year one, we saw 10% growth in our business. And that was primarily because we had clear data, we had regular, timely access to the data, and we had the ability to dig into the data and do the analysis on where the opportunities existed so that before we closed, we had an aligned game plan. So we stepped off together with our partner doctor now on day one on the areas of opportunity that we were going to address from the start. And so that is the way that we're quickly able to integrate practices. And we take a first do no harm approach where we buy a practice, we're pretty happy to have that practice. And what we don't want to do is we don't want to go in there and upset the apple cart and change all kinds of things for that team that's done so well and performed admirably, so much so that we wanted to buy their practice and partner with that team. And then if we came and made a bunch of wholesale changes, you can imagine what would happen. So what Treatance allowed us to do, rather than coming in and saying, hey, we recognize that you're using EagleSoft, but our primary system is Denticon, we're going to switch you over. You can imagine the heartache that would create when for years they used EagleSoft. And now we're making them on day one begin to use our system. We don't change their system at all because Treatance allows us it provides us this umbrella over all of these disparate systems, aligning our data definitions, providing one set of dashboards that matter to us, that provide the KPIs that my operating team needs, provides the depth of analytics for my clinical leaders so they can see by provider, the types of procedures they're performing, and those types of things. And what I'd also tell you is, one of the things that the analytics have given us that we did not have until we got together with Treatance is we could see procedures that our teams in the offices were offering at no charge, and in fact were chargeable procedures. So just by virtue of charging for things and services that we were rendering, we saw an uplift across the platform in revenue. So again, the benefits here have been, in addition to flexibility, in addition to data integrity, they've also given us the ability then to come in and place this reporting umbrella over all of our practices across the platform and to get the analytical data that we need to make solid business decisions. So what this slide will show you are two things. And in the center column there, optimizing operations, that's primarily a rev cycle a reference, and I'll take you through that in a second. And then driving value creation on the right-hand side is an operating reference. But on the rev cycle side, here's what I would tell you. Prior to our time with Treatance, we were collecting at about 88% of all of the dollars produced. Not a very good number, frankly. And the problem we had was we didn't have consistent data. We didn't have timely reporting of that data. We didn't have the same revenue cycle metrics, over 30 to 60, 60 to 90 sort of things. We didn't have all of those defined consistently across our software platforms. Treatance came in, we were able to align everything, and what we saw were where the opportunities lie. And the opportunities lied in patient claim denial. So we had claims that were incorrect, inaccurate, incomplete, that were being denied. Now we had visibility to those things and why they were denied because of other parts of our tech stack that integrated with Treatance data. And so we were able to bring in additional technology around rev cycle management that helped us there. But without having that data set that Treatance brought to us or gave us access to with consistent data definitions and so on, none of this rev cycle improvement would have been possible. And I could take you through it. I'm certain you're reading the slide, but if you go to the bottom of that column, then within a matter of 9 to 10 months, we've now begun to pretty consistently collect over 100% of what we're producing as we catch up on some old AR, some aging accounts receivable, and so on. We're seeing better than 100% collections. So fantastic data accessibility, actionable data for the operating team, and we're seeing it and feeling it now in our bank account as we look at cash per day collected, and as we look at the amount of collections from patients on the day of service, and so on and so forth. And here's another key element to this that Treatance was able to help us with that was really meaningful. Our big opportunity lies, or was, with the patient collection component. Well, now as those patients come back to the practice with an open balance from a date of service months ago, we were able to say, you have $110 from your visit back in February that we need to get cleaned up. How would you like to, square up on that $110? And then we're scheduled to see you here in about 5 minutes, and we'll bring you to the back and let the doctor and the team take care of you. So now we know by patient what they owe us in previous balances on what date of service for what procedures and so on. All of that through Treatance has become very readily available, accessible, and easy to use. So now if you go to the right-hand side of the chart, driving value creation, what I would tell you is, again, with our mission to improve overall health through better oral health, we need clinical data, procedure-level data. So we put in place, or I should say my clinical team put in place procedures, protocols, expectations that each patient would get a 6-point probing for hygiene. They would get a full set of a full mouth series of x-rays. These are standard procedures for marquee patients now. With procedure level data by provider, we can see who is and who is not living up to those protocols. Because if our doctors are not following the protocols, how will we ever as a platform fulfill our mission of improving overall health through better oral health if our approach to overall health is haphazard and we hopscotch our way through patient care? All right. And then, down at the very bottom, you can see we've driven organic growth and revenue per visit growth by having visibility to the key procedures by provider and the level of data we need to take action where doctors or hygienists may be struggling. All right, so kind of cutting to the chase here. At the end of the day, we had massive data challenges that come, and I suspect with any of you who have a multi-site healthcare business, you're experiencing the same things that we experience, which is challenges getting with data integrity and making sure that you're getting each day an actionable set of comprehensive, accurate, timely data upon which your operating team can and your clinical teams can act. That is what Tredence brought to our partnership. We've now begun to be very effective from day one of partnerships as we continue to buy practices. We're able to look at the data from those practices that we get in due diligence, in the due diligence phase, as we're approaching the closing date of buying that practice. So we can look at the data ahead of time and see where the opportunities lie that allow our new partner doctor and Marquis' leadership to game plan growth from day one. And again, Tredence brought us that capability. And then finally, value creation came to us as the operating team was able to get dashboards that were meaningful to all of us in Marquis, with KPIs that matter to us in Marquis. And I'll tell you specifically what I mean by that. We have 5 key metrics, but I'm going to tell you about 3. One is doctor days. These are the numbers of doctors that show up to work every business day. Visits per doctor day, and these are the number of patients per doctor day that a doctor sees. And then lastly, revenue per visit, which is the work that a doctor does per visit with a patient. When I can see each day those 3 metrics, and every one of my field operators can see performance within their region on how each provider did that day, the number of patients he or she saw, the amount of revenue that was generated with each patient, and the number of doctors that showed up to work in each practice each day. Now you can see the power of the day-to-day execution in the field. But for me, making decisions around how much money to spend in marketing, or how much money to spend in recruiting dentists, or how much money to spend in clinical education to drive more, greater production and so on. You can see now where I can make a very informed decision on marketing spending, on recruiting, and on clinical education and technology to support doctor diagnosis and treatment. So that is, in fact, those are the 3 big buckets of spending that Marquis has outside of running a practice, right? Outside of paying for labor and supplies and labs and so on. I aggregate spending around marketing. I aggregate spending around clinical ed. I aggregate spending around marketing, recruiting, and clinical education. Okay, so that's how all of this data and all of this capability that Tredence has given us has gotten us to this point where we're now creating great value year after year. And we've positioned ourselves now as dentistry goes through consolidation and more DSOs start up every day. The thing that will separate the final 5 or 7 of us who will be left standing and will be the end game winners as dentistry consolidates will be having actionable data that drives business performance, drives better patient outcomes, and in the end, I think positions Marquis to be, by my projection, a $500 million business by 2028, just by taking care of the populations we serve today through better oral health. Pradeep, back to you.
Thank you, Fred. Yeah. So just to sort of summarize, right, today what we really do at Tredence is we work with healthcare organizations to understand their data, have their playbook, understand what technology challenges that they could have. And then that's really what we did with Marquis as well. So when we first worked with Marquis Dental, there were 42 practices, and as Fred mentioned, just 11 different EMR systems, right? And the challenge was just humongous because ideally, even more than 3 or 4 PMS systems, it becomes really tough to integrate those data together in a cloud environment and start creating insights with it, right? But with what we have did is sort of understand what are the business KPIs, business use cases, right? What would be those key areas where the speed to value is more? And that's exactly what we have did, right? So day zero, we refine our M&A playbook, understand what is the acquisition that's happening, and on day one of the acquisition, that's when we enable these dashboards and so on. Right? So with that said, why don't we just sort of go through a couple of questions? Over to you, Maria.
Yes, happy to do that. So we have some questions. So for you, Fred, why Tredence and not any other vendor? Can you talk about what makes Tredence unique?
Yeah, thank you, Maria. I think there are a couple of things that I would emphasize. The first is I didn't start with Tredence, but I ended with Tredence. We did try out other reporting umbrellas, and that was the way we started with Tredence. Was starting out with just help us get better dashboards, help us get better data definitions, more consistent data definitions, and so on. Tredence was very adaptable, very receptive. Pradeep referenced this in his introduction. He and I go back a few years, and in the early days, I think we were their first dental platform, and so they were interested in learning more about dental so that they would become more valuable across healthcare verticals, and dental was a chance to expand. So for them, there was that win, and for us, there was this partner who was willing to be open-minded about dashboards that we were interested in, providing us KPIs that mattered to us and that we knew factually would drive our business, and then have evolved with us as we've grown and our needs have evolved. Tredence has come with us. They've helped us completely overhaul our revenue cycle. They've helped us with this front-end diligence work where they've uploaded data from the diligence package we get and put it into the system so that we can look at practices that we plan to acquire and see how they measure up against practices in the platform today. So there were so many flexible elements to the services they provided. They were receptive. They were present. Pradeep came to Nashville, where we're headquartered, several times. Some of his colleagues have been to Nashville as well. So it's a receptive team, a team eager to help solve business problems, which, again, I've had a lot of partners across the board in 7 or 8 years at Marquee. And I can tell you that this is a group that makes your problems their problems. And I love that about them. Appreciate that very much about them.
I still remember Fred used to call me late in the evening and say, "Fred, where is my report? Where is my data?" Right? And it was just a lot of back and forth between us and Marquee, right? I think it's just, for us, it was just about being, transparent with the process. Communicating, I think the biggest hurdle I think we came across was the more we communicate, the more we understood each other's ecosystem. And most importantly, I think the goals between Marquee and Tredence was how do we solve the business problem? I think the technology comes later. You could use any technology that you want, but are we solving the business problem or not, right? And I think that was probably these things are the secret sauces. I would say that has probably worked between Marquee and Tredence.
Yeah, that's fantastic. And to our audience, I just want to let you know we've opened Q&A. So if you have any questions for Fred or Pradeep, please send them along using that chat function. Okay, another question for you, Fred. How did you change the mindset of operational leaders to become more adaptive to data-driven decisions?
Well, we in our early days didn't have a deep bench of operators. What we ended up doing therefore is hiring operators, from outside of Marquee, some outside of dental altogether, and others came from other DSOs. And what was important to me was that I galvanized the team around those three key metrics I mentioned to you. One being doctor days every business day, one being visits per doctor day, and the third being, revenue or production per patient visit. And the only way I could get these operators who would come in from outside of dental, or get operators who had been in dental but in another platform, the only way I could get them to come in and become an effective performer in our system was to understand that those were the three key metrics that I was spending money around. I was spending it in marketing, clinical ed, and technology, as well as recruiting. And I beefed up my recruiting team, right? We got an outside marketing agency to help the existing team there, and so on. And so it would have been inconsistent of me to pound on those three KPIs and then not provide the reporting that Trident's provided, or to have different expectations of the operators. So whenever we got together, I was talking about those three. So no matter the practice that the operator was describing or talking about, I would always ask, how many doctor days per month are you getting? How many hygiene days per month are you getting? How many visits per day are you seeing? And that type of thing. So it got them thinking the same way that I was thinking. And the reporting that they would get each day, it was right on the dashboard, right in front of them. So all of this began to tie together. So to change the mindset, I had to define a very finite set of KPIs. I needed those KPIs reported on a regular basis. I needed them to be accurate, trustworthy, and I needed them to be complete, so that some offices didn't drop off on one day or they were on another day, and that's, I couldn't have that inconsistency. And again, what Trident's brought to me was the ability not only to identify those three KPIs for every practice every day, but also to provide them on a dashboard that was simple and easy to access for my operating team. And then whenever we were together, those were the things we talked about.
Yeah, that's great. Sorry. Do you all plan to use generative AI technology at Marquee? And if so, what are a few use cases?
Yeah, Maria, thank you for asking that question. I want to go back because I made a couple of references to this. I talked about population health management, and that Marquee was purpose-driven. When we started Marquee, the purpose was specifically to improve the populations we serve through better oral health. All right, to improve overall health through better oral health. My dream comes to life through generative AI. And again, I imagine a world, and it exists today, and it just isn't in dentistry. It isn't as prevalent in dentistry, but we're going to move that way over the next year and a half, so that by 2028 we are generating the type of care and business that I referenced earlier, $500 million. Because I think the DSOs that are left standing in the next 3 to 5 years are the DSOs that are addressing, they've become a part of the health ecosystem for each patient. And so generative AI, if you can imagine, I have a certain healthcare record that my physician has and my cardiologist has and so on. But I also go to a dentist, and those two systems, those two records are disparate today in Marquee's world. And in my dream, they come together. And imagine now my doctors who are seeing patients at least 2 times per year, maybe more than they're seeing their physician. 2 times a year, my doctors get a chance to assess the systemic health from an oral health, through an oral health lens. But they get to look at healthcare records in total, and then look at what they're seeing in the patient's mouth and diagnosing through treatment, or diagnosing through all of the technology we provided to help them with diagnosis, and looking at the oral health indicators that may be leading to systemic problems. Now bring those together and imagine generative AI can provide for me specifically a health plan, a life plan a treatment plan tailored to my medical history, dental history, and so on. And again, dentists are uniquely positioned because we see patients at least 2 times a year. So generative AI to me unlocks the keys to all of this. And we can tailor treatment plans to each patient individually and not, and I'm going to use a rough example, but for every filling need, there's a filling, right? For every crown need, there's a crown. But imagine if now we've done 4 crowns on the same patient at one time, something changed between the last visit and this visit, and we start looking at the overall health record and we see some indicators that these 4 crowns are the lead indicator of systemic problems that the patient is experiencing or had just started experiencing. And so if we address the oral health component, remember, 54% of the patients we see every day have a restorative need. They need a filling or a crown. 62% have disease. So if we start to address all of those things, and generative AI can help create a treatment plan unique to that patient, we can get after these systemic challenges that are afflicting so many Americans today. There's my answer, Maria.
Yeah, that's a really good point. That would be a very exciting future if we would be able to achieve that. So what does the future look like for Marquis from a business perspective? Kind of what are you looking ahead to?
Well, yeah, thank you again, Maria, for the tee up on this one. I referenced it a moment ago. I got into healthcare having been in fast food for 15 years. So, my lighthearted comment on that is for 15 years, I was trying to kill people with fast food. And then I moved over to healthcare. And for now 15 years, I've been in healthcare trying to help them. But put that aside, my point in getting into healthcare was I traveled a lot. I was in airports a lot, and I would see people hobbling down concourses. I would see people on golf carts riding through airports who could no longer walk that were my age. And I thought, geez, something's changed in our country, and there's got to be a way to address it. And I think dentists are on the leading edge, as I said, on the leading edge of this. And my personal goal is to get more doctors to buy into that vision. You see a patient 2 times a year at a minimum. You can change the face of things if you embrace the total healthcare approach that I'm espousing. So population health can be managed more effectively, starting with better oral health. So when I think about Marquis' future, it is over the next 1.5 to 3 to 5 years, building on that and improving the population healths. The health of the populations we serve around each practice, because each practice has a personality. Each practice's patient personality is different. Some have fluoride needs. Some may have, different types of needs health-wise. And as long as the treating doctor there recognizes, my patient population needs more fluoride, let me address that in my recommended care. This is going to be a massive idea. And in the end, again, I think there will be 5 to 7 groups like Marquis that are endgame winners in the consolidation of dentistry, because we do it the right way. With the patient at the center of it, we can provide unique health plans, personalized life plans, treatment plans, whatever we want to call them, and improve the overall health, because we do a really, really comprehensive and good quality dentistry on the front end.
Thanks, Fred. What are some of the common challenges when you're working with other healthcare organizations that you see come up?
So fantastic question, Maria. And I think it's always been changed, right? If you had asked that question to me 2 years back, right? Some of the common challenges were, I have multiple EMR systems. Can you aggregate the data into one single data layer? Can you migrate my existing legacy systems to cloud, right? Either to GCP, AWS, or Azure, right? But as we are going through this journey and we are working with multiple organizations, the challenges have become more specific, more niche, right? How can we use AI to improve a patient behavior, right? Can we look at the historical data to predict what is the best way to communicate to the patients for billing purposes, engagement purposes, or closing the gap, as Fred mentioned, right? Over the last couple of months, what we are starting to see is the use cases or the challenges that we are seeing is primarily is I have so much data with me. I have petabytes of data, terabytes of data sitting in the different systems, right? Can you bring it together, create some dashboards, KPIs that my operators can look into it, and so on and so forth. And as we are going through this journey, we are starting to transition towards a lot of generative AI use cases where there is a 200-page patient record from the EMR systems. Can we use Gen AI to summarize all that and just create one single page that summarizes the entire patient's? How can we use Gen AI for prior authorizations? How can we use Gen AI to create what we call as the smart chatbot? And as a matter of fact, one of the use cases that we are starting to see as a pattern is automation, right? Today, there's so much work that's been done on the claim side, on the EMR side, right? Can you automate that entire process so that my team can focus on other important things that are more productive? So I think as we are going through this whole journey where it was a data problem, now it is more of an AI problem. We're just seeing that the maturity of the organizations are getting better. They're able to understand what technology can do for them. And I think it's just now being solving the business use case rather than finding what technology works best for them. So that's some of the things that we are seeing when we are working, not just with Marquee, but with all the other customers under my portfolio.
That's great. Any other final thoughts from either of you before we wrap up today?
Let me just add one more piece, Maria, just quickly. For those of you who are in growth mode where you're buying practices and faced with the challenge of integrating them, one of the ways that we were able to bring dentists along with us on this journey, the selling dentist, this is their big event in their life. They've built a practice, got a point where they want to sell that practice. It's a very emotional thing, a very emotional decision for them. The way that we were able to get doctors, dentists comfortable with this transition obviously comes over time as you build trust. But the other is by having data and letting the decisions for how we would grow the day after the deal closed, we have data that came to us by virtue of Tredence's work, where we could sit with that selling doctor and take the emotion out of some of this, not all of it, but some of it, and make our decisions going forward based on data. And data-driven decisions, of course, will lead you, will set you free. And so my point here is we all will be, those of us in the business of buying practices and integrating them, will be faced with the emotion of that sale and that acquisition. And again, one of the ways as we were going forward so that we didn't come off as being pushy or aggressive and making the seller and the seller's team uncomfortable was to focus on the data and sharing the data, being open with the data, what we see, what they see, and then together putting together this plan that would take us forward, stepping off from day one, stepping off together. But again, having timely, comprehensive, and accurate data allowed us the ability to do this. So thanks, Maria, for the opportunity there.
Just one follow-up question to that. Was there any pushback on the data once they got it? And did that require any, any work on that end to even buy into the data once they were seeing it? Maybe it was outcomes they didn't want to hear. Did any of that come up?
Oh, sure. If I understand your question correctly, it is, Was there any skepticism about the data when we shared it with them? Was that
Yes.
the crux of your question?
Yeah.
Sure. In some cases, we took their data, ran it through Treatance, and got a little bit of a varied outcome from what they were used to looking at. And so their paradigm was what they were used to seeing every day. And now what we did was we moved their data into our data warehouse, and we were comparing them apples to apples with the rest of the doctors and the rest of the practices in the platform. So of course there was bound to be some response to that from the doctor. And usually we explained it to them that way, and they understood. Now what we're doing is we're just leveling the playing field here so that we can do an apples to apples comparison. And they understood it. And then, sometimes we had to relent a little bit on something that they might be very emotional about, not agreeing with, or didn't buy what the approach we took. Maybe they didn't like that approach. So, again, we gave some ground to get some ground, or gave some ground to gain ground. But yes, there was skepticism. Again, our approach has always been being open and honest and transparent. And in so doing, you build trust. And then over time, in cases like that, we've gone back to the doctor months later where they've gotten more comfortable with us. We've built more trust with their teams, and they've said, all right, I don't mind if if that's the way you want to, judge us, if that's the right word, or assess our performance, then go ahead. We understand what you're doing now.
Okay, great. Thank you. Well, thank you both so much for your time this afternoon. This was a great presentation. And we'd like to once again thank the sponsor of today's webinar, Tradence. For more information about them, please visit their website, tradence.com. And to our audience, thank you for tuning in. We'll be sending out an email following this event with a link to watch this presentation on demand. And then please also stick around for the survey following this event. We'd love your feedback. Thanks, everyone, and have a great day.
Thank you.
Thank you so much for the opportunity. Thank you.
Thank you.